Okay, for my demonstration speech, I'm going to be showing how to do CPR. And since I don't have a practice dummy or anything, this is going to be the head of my person, and I'm using a pillow as the chest and abdomen area. Okay, so first what you want to do is, especially to make sure your area is safe so that you won't get injured while trying to save another person. And then next, what you want to do is make sure that they're unresponsive. You want to say, hey, are you okay? And tap them on the shoulders hard. And then you want to put them on a flat area. Most likely the ground is probably where is the best place to put them. And then after you've determined that, first you got to make sure they're breathing. If they're not breathing, that's when you want to do CPR. And what you do is you put your first hand like this, and you'll want to put it right, usually in between the nipple line is usually where you want to do that, because you don't want to go too low, because there's a little piece of bone that you can feel right here, and if you break that off, it can cause even more damage. So you take your hand, you put it like this, and then you'll wrap your other hand around it. And what you want to do is this. You do it 100 to 120 compressions per minute, and then it's 2 inches down, which is about that much. Well, that much. And it's better to go too far than not far enough, because you are going to break some bones, especially if they're an older person. But, no matter usually who you do it to, you're going to break some bones. So don't stop if you hear a crack. It's pretty much just normal. So what you do is you're going to press it down. And if there's someone around who knows CPR, you want to switch off with them, usually 2 to 3 minutes, even if you're not tired, so that you know that you're giving good compressions to the person and you are helping them. And so I went through some EMT training, so I will run through what an EMT would normally do, or any person at all, really. So, but if you are giving breaths, you want to do it 30 compressions to 2 breaths, and make sure you're not stopping the compressions for more than 10 seconds. And the breaths for an adult are not as important as the compressions are, because they're more likely to have a heart problem than a breathing problem. Whereas for children, it's more likely for them to have a breathing problem than a heart problem, so you want to be giving them the breaths. Those are really important, because some people, they just don't feel comfortable doing mouth-to-mouth breathing for them. So for adults, it'll probably be okay if you're not giving the breaths, but a lot of times you'll have sometimes there'll be this little thing that comes with first aid kit or an AED device that you can put in the mouth to breathe through, and it'll make sure the breath is getting into them, but their breath's not coming out to you. Okay. So an AED is what you're going to use to start the heart up again. One will go here, and the other one usually goes around the side, kind of over here, so that you make sure that their heart is getting shocked. So what I'm going to do is go through the actual motions to what you would do if you suspected someone of needing CPR. Okay, so first what you want to do is see if your scene is safe. Okay? And then you want to check to see if they're responsive. And if they're unresponsive and they're not breathing, that's when you want to start CPR. And you want to tell someone, point at someone, make sure they know you're talking to them, and say, hey, you, call 911, get an AED. You want to point at someone because if you just announce it to a group, everyone in that group is going to think, oh, this person will do it, so I don't need to. So you want to make sure you're pointing out to a specific person. And then what you'll do is you'll start compressions. Keep your elbows locked and make sure you're going down 2 inches. It's kind of hard to see because I don't have an actual test dummy. So you do 30 and then you'll do 2 breaths. If you don't have a mouthing and you still need to give them breaths, you would pinch their nose and cover their mouth completely with your mouth. And what you're going to want to do is look to see if their chest is rising and falling with the breaths you give them, because then you can see if your breaths are working properly. And then you keep doing that, and if you can switch off with someone, it's a lot better because then you won't get as tired, and you can make sure that that person is getting the adequate amount of compressions that they need. So then, if, say the person comes and brings back the AED, it'll show you on it, like on the pads, where you're going to want to put it. So you put one, usually, it'd be one here, and then one off to the side somewhere. It'll show you if that, like, what exactly it looks like. But first, what you're gonna want to do is turn it on, because it'll speak to you and say what it wants you to do. So it'll turn it on. It'll say, hook the pads up, because normally that's what you were gonna have to do. And then it'll say to attach the pads. So that's when you'd attach it to the person. And then it'll say analyzing heart rhythm. And then you want to make sure that everyone's clear of the patient so that no one's touching them, because then the AED could see that there's a normal heart rate because you're touching the person. Because the AED is not going to let you give a shock if it thinks their heart's working. If you make sure everyone's clear, then it'll say analyzing heart rhythm, and it'll either tell you shock advised or shock not advised. If it tells you shock advised, it'll then, you make sure your patient's clear, then you deliver the shock. And then the AED will usually tell you to resume compressions. So that's when you start doing the compressions again, 100 to 100 per minute, and 30 compressions to 2 breaths is the rates you're going to want to go at. For children, it's the same thing. And then for babies, what you'd consider baby is anyone under 1 year old, you just do 2 fingers because the space is smaller on them. And sometimes with children, you can do 1 hand, but I know for me it'd be easier to do 2 because I'm not as strong. So that's how you'd give CPR to an adult patient. For children, sometimes AEDs will have child pads. If you're not sure if someone is an adult or a child, use the adult pad. Because if you use child pads on an adult, it's not going to work as effectively because it won't deliver enough shock. For babies, you'd put one, the children, usually it's the same place. But for babies, you put one on the front, 1 pad on the front, 1 pad on the back. And that's what you do for CPR and AED use.